Hey, how are you feeling? Yeah, that's totally to be expected. I understand. I'm pretty sure that everybody feels that way before these visits. Honestly, even me. It's just a lot, and it's very vulnerable. So, completely understand. Really quickly, just a few questions to get things moving. Can you verify for me your name and date of birth? Perfect. Any new concerns since your last visit? Okay. Okay. Any recent spotting or changes in discharge? Any pain? And any change in your medications? Okay. What's the new strength? And twice a day. Okay. You got it. All right. So, as you know, your last pap showed some abnormal cells. So today we will be doing something called a colposcopy, along with a repeat pap to get a closer look. What a colposcopy is it's a biopsy of the cervix. So I'm going to take just a teeny little bit so that way my lab can further investigate and identify whatever the cells were more closely that caused the abnormal result. Most of the time, these are benign, but we always need to check, okay? That's really important. And I will make sure that you don't feel anything, right? You might have some spotting and a little bit of soreness after, which should be easily treated with just some over-the-counter pain medications, right? In some cases, people have a little bit of cramping, but normally my patients don't experience that, but everybody's body is unique, so I can't rule that out. If you have any kind of intense pain or more intense bleeding, then I want you to give me a call right away, okay? And then we're going to re-examine you. Okay. So, I'm going to put on some gloves. How's your summer been? Yeah, it goes by so fast, doesn't it? I feel like, for my son anyway, like school just got out and now we're already about to register for fall football and start getting ready for the school year. It's just crazy. It never slows down, does it? Right. Okay. So we're gonna get started. And first thing I'm gonna do is actually lower my stool if I can find the lever. Okay. And position my light so we're better able to see. So, okay. I'm going to start with just an external exam, ruling out the presence of any lesions, any suspicious skin growth, anything that might be considered abnormal, okay? I'm also going to be kind of palpating around your inner thighs, feeling for something that we call inguinal nodes, which can pop up sometimes if we have an infection present. So, if it's okay with you, I'm going to move your gown back just a little. Thank you. And if at any point you need me to take a break, okay, please let me know. So, I'm going to start with your inner thighs. You're going to feel my hands. Are you ready? Okay. Any soreness or tenderness in these areas? Okay. So now you're going to feel my fingers, right? Yep, exactly. And I'm just taking a look. Any pain or tenderness? Okay. Good. Not seeing anything irregular. So that's good. Okay. So now if it's okay with you, I'm going to start an external exam. And I will be using a lubricating jelly to help make this as comfortable as possible. So, oh, this is a brand new tube. Okay. So I'm going to be feeling your cervix, your uterus, and your ovaries. And please, if anything is tender or uncomfortable, don't be shy, okay? Okay. So, I'm gonna feel my fingers, okay? I'm gonna enter. I'm gonna feel my hand pressing on your tummy. Any pain? Okay. Okay. Everything feels alright there. So now I'm going to be using a speculum, and I know it's not the most pleasant. The one we have is a bit of a smaller size, so it should hopefully be a bit more comfortable, though it won't be totally comfortable, as I'm sure you know. Okay, so I'm lubricating my speculum. And it's going to be a little bit cold, okay? I apologize for that. Alright. Okay, feel it kind of shift a little All right. Okay. Just taking a look. Now for a brush, and this is going to be a little bit spicy. I apologize. And I'm going to remove my speculum, okay? Oh, come on. Okay. Apologize for that. This thing is not the greatest. So I'm going to take off my gloves so that way when I prepare your medication, I have clean gloves on. But I'm going to need to take just a moment to let my hands dry because they get a little sweaty. So I'm just going to be taking some notes, okay? just need to check your allergies. Okay, we're good. So the medication I'm going to give you, which is going to block you from feeling any kind of pain, okay? It will not make you feel drowsy. We do still ask that our patients hang around for a little bit, just because we want to make sure that there are no other side effects that might impede your ability to drive home, okay? Just like 10-15 minutes. It won't be too long, I promise. Sorry, I just need to figure out where my assistant put my syringes. We have a new hire, and she's learning. But had a little bit of trouble locating some supplies. Okay. Putting on some new gloves. Okay. Do you have an arm that you would prefer that I use? Okay. No, it's not going to make you sore. It's not like a vaccine, I promise. So you're going to feel my alcohol swab. Feel me squeezing the muscle away from the bone. Good job. Okay. I know it's kind of more of like a blood draw bandage, but it'll do. Okay. Give that a moment to kick in. Okay. So this guy is called a punch biopsy. It's gonna take like a 2 mm sample, and it'll feel potentially like a little pressure, but truly you shouldn't feel anything at all, and you really shouldn't feel any pain, okay? Okay. So I'm going to prepare my speculum again. Got some lubrication on it. Okay. So you're going to feel my fingers. Are you ready? Okay. You're going to feel my speculum. A little wider, I'm sorry. All right. So, when I say when, I want you to cough for me, okay? Okay. So I'm just getting into position here. All right, cough. Good job. Okay. That was it. Okay. All right. Yeah, let's get this prepared. Okay. I'm going to pull your gown forward, okay? Okay. And raise my stool. So, let me just document really quickly. 27. Okay, sorry, we have to document everything we do, especially medication that we give you. So I just need to do that really quickly. So, okay, we're going to have you stay here 10 to 15 minutes. One of my assistants will come in and let you know when that time is up and check in on you. If anything starts to feel not right, there's a button right here. See that? Yeah, looks like a doorbell that you can push and it'll alert us to come in and check on you, okay? Okay. Like I said, you can expect to experience a little bit of spotting, a little bit of soreness, potentially some cramping. Please feel free to treat that with over-the-counter pain medications, all right? And you can actually double the instructed amount of like ibuprofen. Don't do that with Tylenol, but with ibuprofen, just make sure that you eat it with food and that you leave about an 8-hour gap in between taking it again. Okay? Okay. And again, like I said, if the pain starts to become more than just a minor annoyance or you start seeing more bleeding, then I want you to give me a call right away. Even if it's after hours, I can be paged, all right? And I would love to be paged for that. So please call. Okay. I will be giving you a call in 48 hours to check on you anyway and see how you're doing. And generally these results have about a 2-week turnaround. Sometimes it's faster. Sometimes we'll get a preliminary result about a weekend. Whenever I have news, I will let you know, okay? Even if I don't have results yet, because I know this can be very anxiety producing, so we want to make sure that you have peace of mind as much as we can give you. All right? Okay. So then, before I step out, did you have any medications that you needed refilled? Yeah, we can do that. And okay, so it looks like you have Caremark, and that's mail order. So we'll do a 90-day supply. And I'm going to give you 3 refills. And then when those refills are out, I would like to reevaluate you, okay? Okay. Okay. Anything else I can do for you? All right. I'm going to go pass this prescription off to one of my assistants, and someone is going to come in here and check on you in about 10 to 15 minutes. And like I said, if you need anything, please push that button. Okay? Okay. Well, it was really nice to see you. I'm sorry that it was under these circumstances. You take care and we'll talk really soon.